Your heart beats roughly 100,000 times a day, pumping about 2,000 gallons of blood through your body without you ever having to think about it. But here's the sobering part. Heart disease rarely announces itself with a single dramatic moment. For most people, it builds quietly over years, through small changes that get written off as just getting older, long before anything resembling a heart attack ever happens. So today we're walking through 7 signals your body may be sending you right now. Signals that are easy to dismiss, but that your heart may actually be trying to tell you something important through. Stick around until the end, because sign number 5 is the one most people over 60 completely brush off. And it's often one of the earliest warnings. If you're new here, welcome to Daily Body Signal, where we help you understand what your body is trying to tell you, one signal at a time. Hit subscribe so you don't miss the signals that matter most as we age. Let's get into it. Why the heart changes as we age. Before the signs, a quick foundation. As we get older, blood vessels can naturally become a little stiffer, and the heart muscle can thicken slightly, changes that are a normal part of aging on their own. The trouble starts when these normal changes combine with risk factors that become more common after 60, high blood pressure, high cholesterol, type 2 diabetes, excess weight, and years of accumulated wear on blood vessels. Together, these can quietly narrow arteries or strain the heart muscle over time. Like the kidneys, the heart has a lot of reserve capacity. It can be working harder than it should for years while you still feel mostly fine. That's exactly why paying attention to subtle signals matters so much. Let's go through them. The 7 signs. Sign 1. Shortness of breath during everyday activities. Getting winded on a hike is normal. Getting winded, walking to the mailbox, or climbing a single flight of stairs you used to manage easily is different. This can happen when the heart isn't pumping efficiently enough, causing fluid to back up toward the lungs. It's one of the most common early signals, and one of the most commonly blamed on being out of shape. Sign 2. Fatigue that feels disproportionate. When the heart struggles to pump enough blood to meet the body's demands, muscles and organs receive less oxygen-rich blood, which can produce a heavy, persistent tiredness, even after simple tasks like grocery shopping or light housework. Sign 3. Swelling in the legs, ankles, or abdomen. When the heart can't pump efficiently, blood can back up in the veins, pushing fluid into surrounding tissue. This often shows up as swelling in the lower legs and ankles, and in some cases, abdominal bloating. Like with kidney-related swelling, occasional puffiness is normal. Swelling that's new, persistent, or worsening is the signal worth noting. Sign 4. A persistent cough or wheezing, especially when lying down. A cough that lingers for weeks, sometimes with white or pink-tinged mucus, or one that gets worse when lying flat, can be related to fluid buildup in the lungs from reduced heart pumping efficiency. This is frequently mistaken for allergies, a lingering cold, or acid reflux. Sign 5. A racing, fluttering, or irregular heartbeat. This is the one most people dismiss. Occasional flutters can be harmless, but a heartbeat that regularly feels fast, irregular, or like it's skipping can be a sign of an arrhythmia such as atrial fibrillation, which becomes more common with age and raises stroke risk if left unaddressed. Many people describe it as feeling off without being able to say why, and simply get used to it rather than mentioning it to a doctor. Sign 6. Dizziness or lightheadedness, especially when standing. This can happen when the heart isn't pumping enough blood to the brain or as a side effect of blood pressure medication that needs adjusting. Occasional lightheadedness happens to everyone, but frequent episodes, particularly with other signs on this list, deserve a closer look. Sign 7. Discomfort in the chest, neck, back, or arms. Not all heart-related discomfort feels like the classic elephant on the chest. It can present as pressure, tightness, squeezing, or even discomfort in the neck, upper back, or arms. Sometimes only during exertion and easing with rest. This pattern is often mistaken for muscle strain or indigestion, especially in women, where heart symptoms can present differently than the textbook version. What puts you at higher risk? A few factors raise the risk of heart-related decline, particularly for people over 60, high blood pressure, high cholesterol, type 2 diabetes, a family history of heart disease, smoking past or present, being significantly overweight, a largely sedentary lifestyle. If any of these apply to you, it doesn't mean something is currently wrong, but it does mean regular checkups, including blood pressure and cholesterol screening, are especially worthwhile. Simple habits that support heart health. The encouraging news is that many heart-supportive habits are simple and low cost. Move most days. Even a daily 20 to 30-minute walk supports circulation and heart muscle strength. Check with your doctor before starting a new routine if you have an existing heart condition. Keep blood pressure and cholesterol in a healthy range. These are two of the biggest drivers of heart strain over time. Watch sodium and processed food intake. High salt intake can raise blood pressure and contribute to fluid retention. Prioritize sleep. Poor sleep, including untreated sleep apnea, is linked to higher heart strain. Get regular checkups. Blood pressure readings, cholesterol panels, and an occasional EKG can catch changes early, often before symptoms appear. Manage stress where you can. Chronic stress is linked to elevated blood pressure and heart strain over time. None of this replaces medical care. Think of these as supportive daily habits, not treatment. To recap, shortness of breath, disproportionate fatigue, swelling, a persistent cough, an irregular heartbeat, dizziness, and unusual chest, jaw, or arm discomfort can all be early signals worth paying attention to, especially if more than one shows up together. None of this is meant to alarm you. Your heart is simply sending signals, and our job is to learn to listen. If any of these have sounded familiar, the most important next step is a simple conversation with your doctor. And a quick but important reminder: chest discomfort with shortness of breath, sweating or pain spreading to the arm or jaw is different from the gradual signals above. That combination calls for emergency care right away, not a wait-and-see approach. If this video helped you, do 3 things for us. Hit subscribe so you catch the next video, tap the like button so more people your age can find this, and drop a comment letting us know which sign surprised you most. Subscribe to Daily Body Signal, and we'll see you in the next one.